Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond speaks with Dr. Leana Wen, an emergency physician and public health professor at George Washington University. Dr. Wen is also the former health commissioner for the city of Baltimore. She tells Stephanie that many states are opening up too soon, despite a virus that is still as dangerous as ever. Let's listen.
Dr. Leana Wen, thank you so much for joining me.
I'm happy to be with you. Thank you for inviting me.
So I wanted to talk to you sort of about how we're reopening in a lot of places. So the virus has not gone away. We're really in the same position we've always been. In many states, it's actually surging. So when you see people in restaurants and people in stores and seeing how all these openings are happening, how do you feel? What are your thoughts as a public health professional?
Well, I'm worried because on the one hand, of course, we have to reopen. It was never the intention that we were going to be in lockdown forever until there's a vaccine. I mean, that could be people sheltering in place for a year and a half, or even longer. That was never the intention. But we also know that we reopened too soon, that we don't yet have the public health capabilities of testing, contact tracing, isolation that we need in order to contain the virus. And I also really worry that people are misunderstanding what reopening means. This was never meant to be a one-way street, that now that we are on the path to reopening, that's just how it's going to be. It was meant to be that we would reopen a little bit, see how that goes. If the number of cases continues to decline, then you reopen a bit more. If it increases, then you dial back and maybe reimpose some of those restrictions. But I don't think that policymakers have been messaging that dialing at all. And I also worry that people have been letting down their guard, which I also understand because quarantine fatigue is real. I think a lot of people have made enormous sacrifices in not having kids go to school and so many people losing their livelihoods. And so I understand the desire to try to get back to life as normal. But this virus, as you said, is still there. It's just as contagious as it was before. And actually, I think that we should be on our guard even more now that people are up and about even more. We need to be doing even more of things like social distancing where we can, washing our hands, wearing a mask that protects ourselves and others, and knowing that just because something is reopened and we can do it doesn't mean that we should. And if we engage in one activity that has risk, we don't need to engage in every activity. And I think we need to think about our own risk as our policymakers do a lot better when it comes to messaging about what reopening means to the public.
Mm-hmm. And I agree with you. I mean, it really feels like reopening feels like we've opened the doors. Everybody can just go out. And yes, they're saying like 50% capacity, but it feels like, just because it's open doesn't mean I have to go.
That's exactly right. And I hope that people will begin to think about their individual risk. So definitely think about your individual risk depending on your own medical conditions, but also think about the idea of cumulative risk. So maybe you now are going back to work. Well, by definition, there is risk. Maybe you are interacting with people at work. That brings some level of risk. But just because you're doing that doesn't mean that your kids are now going to all be fine going out on play dates. Just because you're going to get your hair cut doesn't mean that you're also going to a restaurant indoors and exposing yourself even more. So I think we need to think about, well, what are the things that we have to do because it's essential to daily living, like going to work? But what are the things that you can cut out? Because we still need to be trying to reducing our own risk as much as we can.
Mm-hmm. I don't know about you, but I get this feeling, at least perhaps on the East Coast where we are, that there's this feeling that everything's fine, that we really are, everything's everything's going down, all the cases, and we should be feeling like things are going to be back to normal. But we know that there are several states where things are getting dangerously high.
Yeah, the trends are extremely worrisome from around the country. I mean, there are areas like the New York City area and New York, New Jersey, Connecticut, which were the hotspots earlier on back in March. They are definitely clearly on the decline. But there are other places that are on the upswing. And I am extremely concerned about this, that we're seeing in Arizona, in Texas, and Arkansas, for example, that not only are we having an increase in the level of infections, we're seeing a pretty rapid rise in the number of hospitalizations. There are reports already coming out in these areas of hospitals becoming overwhelmed, ICUs at capacity, and patients having to be transferred to different facilities. I mean, basically, this is what happened in New York before we saw the horrible scenes of emergency physicians and technicians trying to play Tetris in their waiting rooms because there were so many stretchers they couldn't fit them in, of ambulances having to wait 4 or 5 hours for the intake of critically ill patients, of tens of thousands of healthcare workers getting infected because they didn't have personal protective equipment like masks. I mean, New York was at a breaking point. We barely averted catastrophe. And I really fear that something like that could happen in other areas of the country. And in fact, that we may not even be detecting these potential outbreaks in places that don't have very robust infrastructure. That there are many places we know that have much less infrastructure than New York City does, with lack of healthcare workers, with hospital closures in recent years, in rural areas that patients already have to travel pretty far for care and face a disproportionate amount of health disparities as it is. And so I really worry about what's going to come, especially because I don't know that there is the political will from so many of our leaders to reimpose these restrictions again that are actually critical to preventing hospitals from becoming overwhelmed.
And when I look at places like Arizona and Texas, part of me thinks, how did we not learn from New York? How did they not learn the lessons that New York learned? How are we not prepared for this surge there?
And I think that's the tragedy of it all. Maybe the first time around, we could say, well, we didn't know how bad it would get. We didn't know what were the most effective interventions. Mm-hmm. Well, we don't have that excuse anymore. We know the lessons from other countries that it is possible to contain COVID-19. Other countries have been able to do this and avert preventable deaths. We learned from this country about how quickly our public infrastructure can get overwhelmed. I mean, we were pretty close to a collapse of the 911 infrastructure in New York, with so many firefighters and EMTs and police officers who are not able to attend not only to COVID, but to other types of emergencies as well, right? I mean, we know that there are excess deaths that are not just COVID related, because people may be dying at home from strokes and heart attacks because they were not able to access healthcare because of COVID. Mm-hmm. And I mean, there really should be no excuse now. We've had now well over 100,000 deaths. We're quickly headed towards another 100,000. And that's not even taking into account the sheer amount of suffering that the over 2 million people have had who have had COVID and are in recovery. And of course, all their family members who are affected too. And so I think all of this we're going to look back at in time as a profound failure of our national leadership. This is the biggest public health catastrophe to face all of us in our lifetimes. And we have not stepped up in the way that we need to.
How could policymakers step up now? I mean, I know the horse is out of the barn, as they say, but how can we step up now there's places in this country that haven't seen the surge yet and may soon see it.
Yeah, I'm glad you asked the question, because we also need to be talking forward, right? I mean, what's happened before? Some of it is hindsight is 2020, but all of it is it already happened. There's nothing that we can do to change that. But what's going to come is not inevitable. All these models that are projecting 100,000 more deaths by a certain point, well, they're models for that reason. They project what could happen, but there are things that we can do to avert that type of catastrophe. So there are things that individuals, hospitals, and policymakers can be doing. And so policymakers should be doing everything they can to increase the public health infrastructure components, the testing, contact tracing, isolation, which frankly we haven't really talked about very much. But if you have someone who lives in crowded multi-generational housing, how are you going to tell them to self-isolate if they have this disease? I mean, there are many proposals out there about converting dormitories and unused hotel rooms to quarantine facilities that were essential in other countries and replacing someone's lost wages with a small sum similar to what we do for jury duty. I mean, we need to be thinking about creative proposals like that. We also have to be doing a much better job of listening to the scientists. I wish that instead of having politicians do briefings on COVID-19, I want to bring back the CDC briefings. They used to be doing briefings every day, but stopped in early March, which again is a puzzling at best. We're in the middle of a public health crisis. Why aren't we hearing from public health experts every day? So that's what policymakers can be doing. Hospitals should absolutely be ready for the next surge. They should be preparing for and getting their PPE ready and making sure that we don't have a situation as we could have had in New York of running out of ventilators and other critical supplies. And I think as individuals, we can do our part. We can all wear a mask. We can try to keep that social distancing as much as possible, and we can minimize our own risk, recognizing that social distancing is a privilege that not everyone has. So the more that we do ourselves, we're also actually protecting everyone else around us too.
Mm-hmm. And something that we've learned throughout this as well is that the racial disparities that we've seen in healthcare have been exacerbated here, and that Black people in particular have been victims of COVID. They've died in large numbers from COVID. And I'm wondering how we can work to address that in the middle of a crisis.
Yeah, I mean, COVID-19 has unmasked underlying disparities. The disparities of Black and brown people who tend to be essential workers without worker protections, of living in crowded environments and using public transportation because there are no options, and also bearing already the disproportionate share of chronic health conditions that predispose to having COVID-19. You know, sometimes when we talk about racial disparities, the problem seems so big and it seems like there's nowhere to start. Well, I think there are small but important, tangible actions that can be taken now, which include having demographic information available, something that basic, not only on infections and hospitalizations and deaths, but also on testing. Because if we know, for example, that the population in a community is testing positive at 10%, but African Americans are testing positive at 20%, well, that means that we're not testing African Americans enough. We're not casting the net broadly enough, and we need to double down on testing African Americans. And so, we need to be doing a lot more when it comes to targeting testing and resources to Black and brown communities, to underserved and most vulnerable areas. And we also have to be strengthening worker protections too. Why is it that only doctors and nurses and frontline healthcare workers are having PPE? We should also be ensuring that bus drivers and cashiers have adequate PPE to protect themselves as well. I mean, there are tangible steps that we can be taking and actually preparing for that second wave now and getting our systems ready for a potential surge. That's also what's going to protect our most vulnerable, because they will bear the brunt of preventable deaths that are to come.
Mm-hmm. We've seen a lot of people gathering for in recent weeks. We've seen these important protests against police brutality. We also see that our political leaders are planning large rallies. None of these sound like they're good for public health purposes. How do we sort of, we know that those rallies are the protests are really important. And sort of where do we weigh the risks and the benefits?
Well, I mean, we have to look at it from a public health standpoint, from an infectious disease standpoint, which is that this is a virus that doesn't care why it is that we're gathering. It is highly transmissible. We don't have immunity to it. Very few of us have been exposed to it thus far. and it is going to spread rapidly from person to person. And so I do really worry about mass gatherings that are occurring at the same time as reopenings are, because you have multiple effects. And I do think that we are going to see potential super spreader events from quite an increase in infections because of this. Now, I do think also we need to recognize that racism is a public health issue, that it is systemic racism, entrenched disparities that have also been heightened because of COVID-19. And so, at this point, we need to be taking a harm reduction approach to everything that we do, recognizing that anytime that we go out in public and interact with others, there is going to be the risk of transmission because that's how this virus works. And so if we're going to go out to do any activity, we need to be taking the steps, as I mentioned before already, but bears repeating, the wearing a mask, washing your hands, keeping social distancing, and critically, don't go if you're feeling sick. These are all things that, again, feel different than the way that we have normally operated. But I think individuals really have to be responsible, as do policymakers at this time.
Dr. Leana Wen, thank you so much for joining me.
Thank you.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.